Good evening.
Kiwanans and guests, I am President-elect Jamal from the Kiwanis Club of New Kingston. Currently with me are DLG Gerthlin, Director Judith, DS Sonia, Kiwanian Kimberly, and Kiwanian Celine. Thank you very much for the invitation. Have a great meeting. Thank you.
Thank you for coming and welcome to the ladies of the Kiwanis Club of New Kingston. Are there any other visitors from Division 23 Central? All right. Division 23 East. Do we have any visitors from Division 23 East? All right, so there be none. We're going to move back home and we're going to take visitors from Division 23 West. Leaders of the delegation, please unmute and introduce your delegation.
President Kevon and other distinguished guests and other Kiwanis. This is President Cheryl from the Kiwanis Club of Diverse Professionals, Portmore Pines. With me this evening are four of us. I have with me P.E. Amelia, Kiwanians Wayne and Christine, and we do hope we have a very enjoyable and informative meeting. And thanks for your invitation.
And the team Diverse Professional. All right.
Good evening, President Kevon.
Good evening.
This is IPP Jennifer, Kiwanis Club of South St. Catherine. Happy to be visiting and greeting on behalf of President Sherry and the other members. So far, we're just two in numbers, myself and P.E. Altia, but I'm sure others will be joining later, so I'll add them in the chat as they come in. Looking forward to an informative meeting.
Good evening, President Kevon.
Good evening, go ahead.
Very cool greetings for the Kiwanis Club of Mandeville. Looking forward to a very informative meeting tonight. So far, we are just two in numbers, Kiwanian Blassett and myself, President Josephine.
Welcome, Team Mandeville.
You're welcome.
All right. I see Denise Ennis. Go ahead. All right, go ahead, President Janet.
Good evening, President Kevon, Kiwanians all. It's good to be at your meeting. We bring you greetings from the Kiwanis Club of the Sunshine City, Portmore. Two of us are here now, and there are two others coming from Kingston.
Wonderful. Happy to have you, team.
Thank you.
You and team President Janet. Wonderful to have you. Any other visiting club? I see my good friend, President Stephanie Wright Grant.
Greetings, DP Kevon.
Greetings.
I am happy to be here, and I bring you greetings on behalf of the Kiwanis Club of Young Professionals St. Catherine. With me tonight online are P.E. Ramona and Secretary Anika. We are looking forward to a rewarding meeting.
Thank you for coming. And it is
You're
always
welcome.
a pleasure to have Team Young Professionals St. Catherine.
Thank you so much.
Yes. DP Don, go ahead, please.
Yes, good evening, President.
One moment, President Lillian. One moment, please.
Yes, thank you, President
Yes.
Kevon.
Go ahead. DP Don?
Yes, sir. Okay, good evening, everyone. Greetings from the Kiwanis Club of Central Portmore. It's our pleasure, of course, always joining Kiwanis Club of Linstead and giving our support. This evening, so far, we have 4 members in attendance, and I'm expecting a couple others to join. Trust that everything goes well, and we're looking forward to an informative and interesting meeting.
Thank you, DP Don, and welcome to you and your team. President Lillian, you can go ahead now, my dear. All right, until President Lillian comes back, Are there any other clubs from Division 23 West? Go ahead, Prez. Go ahead, President Lillian, listening.
DG as I
President Lillian, your microphone is not coming over so clear, but just to say welcome to you and the team from the Kiwanis Club of the First City. Do we have any other clubs visiting from Division 23 West?
Good evening, President Kevon.
Good evening, DP Marianne.
I bring cool greetings from the hills of Geisel. This evening with me is President-elect Esmeline, and we are looking forward to a wonderful, informative meeting. Thank you for the invitation.
And thank you for joining us. It's always a pleasure to have Team Geisel online with us.
I'm going to ask them why I'm doing recognize me.
PE Esmeline?
Yes.
Go ahead.
Oh, well, IPP Marion has done it already.
Okay. I did not see your hand up. My apologies.
Yeah, I started twice and you stopped me. It's okay. Bye.
Okay. My apologies for that, ma'am.
Accepted.
Great. Any other clubs from Division 23 West? All right, if there are no other clubs from Division 23 West, we move to our SLPs. Can the leader of the delegation please unmute and introduce the club? Good evening, DG Mel.
Yes, good night, Mr. President. I apologize for not speaking when you called, but I was on my club's meeting and I could not get the volume down and I didn't want to disturb your meeting. But nonetheless, it is always a pleasure being in your meeting. So thank you for allowing me to be in your meeting tonight and waiting to enjoy that exciting topic that your club has tonight. Thank you again.
Thank you, as always, for joining with us, DG Mel, an honorary Jamaican. Yes. All right. Any other clubs being represented here tonight from Division 23 West?
Good evening.
Good evening.
Good evening, President Kevon. DP Yuan here from Kiwanis Club Spanish Town. Wishing you a very successful and productive meeting. I think I saw 3 members online, including LG Hewitt, myself, and Tuwani and Benjamin. So we are looking forward to a great meeting. Thank you very much.
Thank you for coming. It's always good when our fathers are here with us.
Very much so. We are always here to support.
Thank you. Calling again, any other club from Division 23 West?
Good evening.
Good evening, President.
Yes, DP Kevon. President Amelia here from the Kiwanis Club of North Spanish Town. We just completed our meeting and we decided to join. Looking forward to a great meeting, and we are thankful for the invite. Online, we have currently PR Anya, and we are looking forward to other members joining.
I'm here as well.
Okay, yes, thank you. And Secretary Simone, so 2 members.
Thank you, North Spanish Town, for coming. It's
All
a
right,
pleasure
thank you.
having you online. Any other club division 23 West? Final call for any other club, Kiwanis club that did not get an opportunity to introduce your delegation.
Yes, good afternoon.
Good afternoon.
This DP Stewart from the Kiwanis Club of Kingston. I just logged on and I haven't seen any of my other members. It was not a planned inter-club, but I just thought the topic was interesting. So I've joined and I'll see if any more will join after. But I'm glad to be here.
Thank you very much, DP Stewart. Happy to have you online with us.
Thank you.
I see an SLP, or do we have any SLPs online? All right, so we're moving on. I want to take the, are there any guests who are online tonight? And let me pause here to welcome the members of the new Kiwanis Club that is being formed in Yorton. I see Prospect Alicia is online. Alicia, you're on. So earlier, any other prospects or visiting club, visitors online tonight? Special welcome to my visitor, Curlew Duncan. Welcome, sir.
Thank you, sir. Happy to be here.
Great. Any other visitors of Kiwanians who are on? All right, moving on. I want to take the opportunity once again to welcome everyone who is on the platform tonight and to remind us that if it is that we reach capacity for the meeting, which is 100 participants, to remind us that we are indeed streaming live on YouTube. So you can ask your members who, if they're not able to get in, to join us on YouTube. Okay. All right, moving on. Glad news, bad news. Do we have any good news tonight? Any good news we want to share?
Yes, President Kevin.
Yes.
I have some good news. So President Lillian from Kiwanis Club of the First City, I was on earlier, but I dropped. So the good news is that I've changed my phone and I'm now able to say that I have DLG
Stuff that she gave Sydney, she took that back?
Yeah, Sydney said she never said.
Go ahead, Fred.
Yes, and the glad news is that I am now able to present my delegation, DLG Christine, DP Phyllis, and Chairman Yvette. Thank you so much.
You are more than welcome, my good friend. It's good news when you can hop on over using something else.
Oh my goodness. Thank you.
All right.
Good evening again, President Kevon.
Good evening.
This is P.E. Amelia from the Kiwanis Club of Diverse Professionals. I have some great news. I got an email today that my research will be presented at Child Conference this year on the topic of looking at parental involvement and COVID-19.
Wonderful.
So good news. That's a good news for the Kiwanis Club of Diverse Professionals as well.
That's great news.
Excellent. Great news. Great news indeed. Wonderful.
Congratulations.
Congratulations. Any other good news?
Yes, President Kevon.
Yes.
My good news is that my background check with the youth protection has been approved.
Wonderful, 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 wonderful. Big up DS Lunette. I hope I'm pronouncing that correct, from the Kiwanis Club of, is that Central Portmore? I see CP.
That's correct.
Great. Welcome also to Prospect Denise Harris from our new Kiwanis Club being formed in Yorton. Welcome to all the prospective members of that club. Just want to big you up and say it is a good look when we see you all coming out, interclubbing and fellowshipping with our fellow Kiwanians. Any other good news? Well, my good news Are you hearing me?
Yes, we're hearing
you.
Wonderful. My good news is that, as I shared over the Kiwanis Club of North Spanish Town, is that I'm alive and well, and I feel so happy in my spirit. I can't explain it, but I just feel so happy, and I'm even more happy, even happier, even happier to see all the Kiwanians who have, and visitors who have come out to participate in this evening's meeting. So thank you for making my day this evening. All right, so we're going to take some not so good news. We're going to bad news. Do we have any bad news today? Bad news going once. Well, one of the bad news
Well, not bad news, but sad news of the death of world famous footballer Diego Maradona, who passed away, I think today. We know of him as one of the world's best footballers. And it's really sad to hear of him passing at a relatively young age at this time. So I think that is, sad news.
Very sad news indeed. Our prayers go out to his family. I know these are very difficult times that we are in.
I know some persons the name Diego Maradona might not mean a thing to many persons, but if you're a football fan as I am, you'll know of him as a great Argentinian footballer who has won the World Cup with his team. And one of his legacy, I would say, is that goal that he scored, which knocked England out of the semifinals of the World Cup. And it was revealed that it was his hand and not his foot that put in the goal. And it infamously became the hand of God. That is what he said. It was the hand of God that scored the goal. Diego Maradona.
Yes.
A little history there.
Yes. Yes. Our condolences to his family. Another bad news is the murder, the triple murder that took place in Trial Heights, that's in Spanish Town. A 81-year-old grandmother and her two very young granddaughters. I think the ages are 6 and 8, if I'm not mistaken. 6 and 10. So that is indeed tragic. DS Lunette, do you have a sad news or bad news you want to share?
Actually, I do. Sad news, but it's a little good news as well. My son-in-law, who is a registered nurse, was rushed to the hospital last night. He wasn't able to breathe and he was vomiting blood. But he was released this morning. He's still home, not feeling himself, not well, totally well. So we are been praying and hope that he will be better soon. So I'm giving God thanks.
Well, we will join you in storming the mercy seat and ask
I so
our
much
good
appreciate
Lord
that.
to continue to keep him and for his health to improve.
So much appreciate that. Thank you.
Wonderful. All right. Should I move over sad news now? I hope they're finished. All right. So we're moving right along. Any birthdays or anniversaries for the month of November or for the latter part of November? All right, there be none. I want to just say, just in case you did not remember the birthdays or anniversaries, a happy birthday and anniversary to all celebrants of the month of November. I know a lot of November born. I've been hearing about them, so a happy birthday or a happy anniversary to you. At this point in time, we are going to move swiftly to the Kiwanis education for tonight. If I can get my slide to move over. So Kiwanis education tonight, and my treasurer will be happy with this education. It has to do with membership dues. Now, members of local Kiwanis clubs pays annual membership dues to their club. The dues paid by members generally goes to supporting their club, the Kiwanis District and Kiwanis International. The total amount of members pay in dues entirely depends on his or her club and district. Each district sets district dues according to its budgetary needs, as do each club. Some clubs, for example, may set higher dues to account for meals provided during meetings or to cover meeting rental spaces, while other clubs may set lower dues, leaving meals up to individual clubs. And as a reminder, our dues become due at the beginning of the Kiwanis year, which is October 1 each year. And giving this bit of Kiwanis education, it would be remiss of me not to highlight some of the benefits of being a Kiwanian. If I can get to my screen, one moment, I seem to be having some technical issues. My computer seems to be lagging the wrong time. All right. Right. So to be derived from becoming or joining the Kiwanis family. One of which is that your Kiwanis, as a new member, you will get a Kiwanis card. This Kiwanis card will indicate some of the benefits that you will have. One of which is the Hilton. Kiwani clubs and districts can access preferred rates and amenities from various Hilton properties around the globe. Kiwanis members can also receive special member incentives for becoming a Hilton honored member. It also covers Kiwanis insurance, so Emergency Access Plus, a safety net to provide services. Your health or travel insurance generally won't cover when you're traveling. Individual life-term affordable life insurance for Kiwanis club members with personal assistance selecting the right coverage for your needs. So this is the little bit of Kiwanis education that I want to share with us this afternoon. And I want to just say thank you guys very much for listening. Fellow Kiwanians and guests, we are at that time of the program when we will hear from a very special lady in our midst. And I hope my Sarge is not here tonight because by accident, I omitted to specially welcome our guest speaker for the evening, who is Mrs. Shernette Heslop Barnett. But to introduce our guest speaker, I'm going to now call on distinguished President June Thompson to unmute her microphone and introduce our guest speaker.
Thank you, President Kevon. Good night, fellow Kiwanians and guests. Very happy to see you out in your numbers. I hope you're sipping your cup of tea. Tonight is one of our guest speaker night, and we were focused on diabetes, both in adults and in children. And we have this awesome lady who will be filling us with all the necessary information and remedies. So, this lady is a registered nurse. She's a registered midwife. She's also a critical care nurse. She is a family nurse practitioner, a diabetes resource nurse. Now, embodied in one person, we have a registered nurse, a registered midwife, a critical care nurse, a family nurse practitioner, and a diabetes resource persons. She currently works as a charge nurse on the labor ward at the University Hospital of the West Indies. Aside from nursing and healthcare, she's a mother. She's a mother of 2. And guess what? She is a wife of only 1. She is married, has 1 husband. Who am I speaking about? I am speaking about no other person than Nurse Shernet Heslop Barnett. Fellow Kiwanians and guests, unmute your mics and welcome Nurse Barnett. Oh, that's not a nice word. Please welcome Nurse Barnett. Thank you.
Well, thank you for that warm welcome. Can everybody hear me?
Yes, we can.
Yes, we can.
We can.
Okay, thank you. All right, so tonight I'm gonna be speaking with you. I'm gonna be speaking with you about diabetes, and I will just go ahead. I am hoping I'll be able to answer most of your questions, if not all. But of course, if I am not able to give you an answer, I hope I'll be able to direct you where you can get an answer. All right, so first of all, I want to say that diabetes, well, this month is World Diabetes Month, and World Diabetes Day was celebrated on the 14th of November. And I want to thank you for inviting me as a resource person and a diabetes, well, I'd say educator for the most part. One of the things that we do is try to empower people so that they're better able to manage this condition. So first of all, I usually like to start out with what is diabetes, because if you understand what diabetes is and how it works, then you are better able to manage. If you don't know how to solve a math problem and you get the formula and say, oh, now I've got it, and then you are able to work it out. So it's the same thing with diabetes. Now, diabetes is a condition in which there is too much sugar in the blood. So we as laypersons, most times we refer to sugar or glucose as sugar. Now, this can happen when the body is either not producing enough insulin, or it is not able, the insulin is not able to take up the amount of glucose that the body has produced to move it from one area to the next. Now, the diabetes, it has, well, persons have what you call a predisposition. So if you are over the age of 40, you are from African, Asian, East Indian descendants, or you were born a very large baby, like a 10-pounder, you are obese, you don't exercise, then these things put you at risk. And of course, most importantly, if you have a family member or a family history of diabetes, then you are at risk. So of course, looking at that, we can say, okay, a few of us, there are some predispositions that we can control, while there are some predispositions that we are not able to control. So of course, we can't control our age, and we can't control our ethnicity. So wherever we are from, whatever descendants we are from, we're not able to control that because we're already born into that family. So, and of course, we weren't able to control whether we were born a large baby or a regular sized baby. No, what we can control is our weight, because if we're overweight, we can work on that. And of course, if we don't exercise, it's a good opportunity to start now. So we can think about these things. These are the things that some we can control and some we can't. Now, diabetes, it has, sometimes you'll get some little signs and symptoms, and that will indicate to you that, okay, there is something wrong. And for adults, some of the things that they might experience is fatigue, blurred vision, excessive thirst, hunger, excessive urination, and they might be thinking, oh, I might be passing out of urine because I work in an area where there's an AC and the AC is on, and so it is very cold, and once you're cold, you might want to pee. Also, persons might say, if you're like me, I'll put down the blurred vision sometimes to, oh, I am getting old and I can't see so well, the vision will go. So sometimes we just pass off these things. We might be saying, oh, why am I eating so much? But we're not making any more of it. It's just, oh, I just feel this craving. And of course, you might be drinking a lot and you say, oh, it is summer in Jamaica, it's hot. Or you might, once you drink now, you might be passing a lot of urine and you say, oh my goodness, I've had so much, I just keep peeing because I keep drinking. Now, these are some subtle signs that your sugar might be out of control. It does not mean if you're having any of these symptoms, that means your sugar is out of control, but it's a subtle sign that you might really be having some sugar issue. Now, another thing that you might experience is numbness and tingling, and that usually happens in the hands and the feet. So sometimes you might find out, oh my God, I don't know, but I feel this little numbness, and you might wiggle your fingers and twiddle your toes to try and get back that normal sensation. This could also be a sign that there is some sugar, the sugar being out of control in some way or another. Now, what happens when you have that excessive, remember we said diabetes when there's too much sugar in the blood. So normally when you eat, whatever you eat, it is broken down and stored in the body as glucose. So some persons say, oh, I'm not gonna have any sugar because I don't want my sugar to be high. No, so if you eat your vegetables, your fats, anything that you eat and everything that you eat is broken down and stored in the body as glucose. Now, when there's too much sugar now or too much glucose in the blood, because what happens is that there's an organ in the body known as the pancreas that produces insulin. And what the insulin does when you eat, it takes the sugar from the blood and transports it over into the cells. Now, if the sugar is not getting from the blood and into the cells, then that is when you will, if you do a finger prick, you might realize, oh, the sugar is high. Or some persons, it's just a urine test that they did and it showed that they were having a lot of sugar in the urine. Now, if we understand what I just said about the sugar moving from the blood, the sugar moving from the blood and into the cells, then you would realize some of the signs and symptoms, how they come into play. Now, if you're eating and you're always hungry, that means the body, because when it is not in the cells, the body cannot use it. So if you're eating and you're always hungry, it shows that now the sugar is not going where it should be, and that is why you're ever so hungry. Now, the numbness and tingling is sometimes a sign of nerve damage, and what can happen is that you might have sugar for a long time, or I'm gonna just say sugar, but I'm talking about diabetes. You might have had diabetes for a long time and you don't know, because sometimes it's like a little creeper. So it will creep up on you, you'll have these little symptoms and you don't really pay much attention to it. And then all of a sudden then things, so while it is out of control, it is causing damage to your body. And I must say that diabetes affects every organ in the body, because remember now the blood has to circulate right throughout the body. So the diabetes will affect every organ in the body. So we have to be very conscious about how well our sugar is being controlled. Now, when I'm doing my teaching, I like to associate this lack of blood supply, because when the sugar, I shall assume that everybody knows molasses, right? And molasses is thick and it does not flow very easily. Now, if you think about diabetes and how the sugar is now in the blood, so you know, of course, the blood is now a little thicker than what it usually is. So of course, the blood is gonna be a little harder to go around all of the body, right? Now, when this happens, every organ is affected. And the body now will try its best to compensate, to make sure that the areas that are considered crucial is being supplied first. So of course, the brain needs to function and the heart needs to function. So the body's gonna tell the brain, okay, the brain says, well, I must get some blood supply. And then the heart will say, well, if I don't get any blood supply, I can't pump anything around anywhere, so I must get blood supply. Now the kidneys, important as they are, and the feet doesn't fall on the priority list when the body is now circulating the blood. So what you will find is that persons will get kidney damage, they'll get eye damage. Sometimes if the blood supply is really not very good and maintained at a high level, then you might also get a stroke or you may get a heart attack. But most times this is when it is really not controlled. Now, I like to liken the blood supply to two companies in Jamaica, and forgive me if there's anybody from any of these companies, no disrespect, but when I think of the body and the prioritization, I think about JPS and I think about National Water Commission. Forgive me, I'm just using as an example. Now, if you owe JPS a bill, one, they give you a grace period, but of course, if you make the date pass, you're gonna pay more. Now, if you don't pay the bill, the blood supplies, they're going to cut off your light. No, so what the body does, it says, okay, the brain is and the heart is my JPS. So I am going to give them their supply first, and then I will pay the water bill, because Water Commission is probably not as strict as JPS, and so they will give you a little more leeway. So of course the body will say, okay, the feet, the hands, the kidneys, they are like my Water Commission, and so you're gonna pay that bill after you've paid the JPS, because one, you can't do without the light. The time is hot, you need to store the meat in the fridge, you need cool water to drink, of course you need the internet, and not having light is very annoying, and you just want to, you just pray, dear God, let them put on back the light very soon, right? So it's the same thing with the body. Now, after a while, sometimes, and let us say we run out of money, and so we've paid the bill this month, and we said, let the water stay a little, and then the next month, you said, yes, I have to pay JPS, I'm gonna let the water hang on a little, and then you might be, did I pay the third month, you might be like, did I pay the water bill? I am really not sure. But of course, by this time now, Water Commission is saying, all right, I've given this person enough leeway and they have not come in to make any payments, so I'm going to cut off the light. I'm going to cut off the water, sorry. So of course, now this is when you start having what we call chronic conditions. So the kidney now doesn't function very well, and kidney disease is very, very expensive. To have dialysis is very expensive. So of course, we don't want to go down that road. We want to preserve those kidneys so that we can save money to do other things. Because when you start doing that, your life is very expensive. Now, of course, the feet and the hands, sometimes what you will find is that you might not even notice that there's anything wrong, but you might be going along and you get a cut on your feet, you don't realize, and sometimes it's just the odor that emanates from the cut. You said, wait, something is stink, man. Let me look around. What is happening in the house? And if you're really not paying attention to your feet, then you might realize when you look, oh my goodness, it is my foot. And this has happened to many persons. So, on a point to note, if you have diabetes and you get a cut, it is very, very important to seek medical attention. Even if you think it is just a simple bruise or a cut, if you have diabetes, it is very important that you go and check it out. Most times you might be needing some antibiotics to prevent any further deterioration in your condition. All right. Now, we've spoken about the ills, and I'm gonna say, I've mentioned much about the childhood diabetes because there are two types. First, they used to talk about diabetes as type 1 and type 2, or they used to speak about juvenile diabetes, which affects the children. Now, what they're finding these days is that there's a thing called maturity onset diabetes of the young. So children might they might be small, but yet they still have what is described like the type 2 diabetes, where they can be treated with tablets or injectable, but let us say mostly tablets. Now, for the type 1 diabetes, these persons, this is a genetic problem, and what you will find is that their body is not able to produce insulin. So of course, if the body is not able to produce insulin, there's nothing to take the sugar from the blood and into the cells. And so these children, they have to be maintained on insulin, and this is from childhood. Now, persons will say, which of them is worst? Both of them is not nice to have, right? Now, the treatment for diabetes is, if it's a type 1, which is what usually affects children, you know they will have to be maintained on insulin for life. If it's type 2, which usually affects adults, then they can be managed using diet, exercise, their medication. Now, persons will say, oh my God, diabetic diet is so expensive, because you're gonna go out there and people are gonna be selling their products. And of course, they want you to buy, and no, of course, it is a chronic disease and a lot of persons are affected. So you're gonna have a lot of companies, or you'll have companies that will sell things that say, oh, this is good for diabetes. You'll find persons that will sell pills to tell you, okay, if your sugar gets low, this is a pill that you should take, and it will help to bring the sugar up. Pills are a little sweetie, but you know, they are labeled for persons with diabetes. Now, I always say you can have a diet, and what is important is that you take things in moderation. So of course, before I learned about diabetes, or before I learned much about diabetes, when my mother would say, oh, I long to eat a piece of potato pudding, I said, Mommy, you know, you're not to have dinner. But what I have learned is that you can have what you want, but it must be in moderation. So they'll tell you, and we encourage persons, avoid fast food, fried food, you bake, broil, steam, and roast instead of frying. But of course, you can treat yourself. So you can have a slice of cake, you can have your ice cream, you can have your KFC or your burger. But what you cannot do, or what you should not do, you should not be treating yourself every day, nor or ever too often, right? Because you can say, oh, well, the nurse said I can treat myself. But yes, you can, but you have to have small amounts. And when you do, you know you're substituting it for something. So if you're going to have your cake, it must be that you're going to give up something so that it does not cause your sugar to go too high. Because remember now, what is happening is that when you eat, whatever you eat is broken down and stored in the body as glucose. Now, another thing is that you don't need to eat a lot. And as a Jamaican, and when I was young, I used to look at my father's plate and want to get big, because Daddy used to get a lot of food, and I usually think, oh my goodness, when I get big, I'm gonna get more food. But really and truly, how we eat, we don't necessarily need all of that food. What we encourage you to do is to have small, frequent meals. And so remember now, the pancreas is producing insulin And the insulin is being used to take up the sugar from the blood and into the cells. If you eat a whole lot of food, then what is going to happen is that you're going to have this large amount of glucose in your blood, and the insulin is not enough to take it from the blood and into the cells. So then you're going to have a problem, and that is when the sugar will go out of control. So we advise that you have small, frequent meals. So you don't want to eat less for your body to starve, and you don't want to eat too much because you don't want your body to go into overdrive. Now, I like to liken the pancreas as your shoe. So if you have one pair of shoe and you're walking up and down in that shoe all the time, after a while, the bottom will go. Now, if you're overstressing the pancreas to produce insulin, after a while, it will give up. And the same, sometimes you might be on your tablet to help to control the diabetes, but after a while, the tablet will not work. And they have different tablets. So if you get your prescription and the prescription has like probably 2-3 different tablets, some work in a way to reduce the amount of sugar, the breakdown of the sugar, some work to increase the uptake, allow the insulin to take up more of the sugar from the blood. So what is important is that when you get it, you understand how it works. So, and people say, oh, I have to be on so many medications. Of course, I will say diabetes, high blood pressure, and high cholesterol, they tend to go hand in hand. I call them a family. So the diabetes and the hypertension are husband and wife, and the high cholesterol is the child. Now, if we understand again how the diabetes works, remember we said that there is too much sugar in the blood. When there's too much sugar in the blood, how it affects the high blood pressure? High blood pressure or blood pressure is really the amount of force that the heart has to use to pump the blood around the body. Now, if the blood is thicker, it is gonna be harder to pump than if the blood was at its normal, what would you call that? Fluidity. So of course, if it is thicker, then it's gonna work harder. Now, when it is because it is working harder, it's not moving that fast. So whatever fat is in it, sometimes the fat build up in the cells, and so the walls of the arteries get thicker. So if you had an artery this size, after a while, when the fat build up in it, it's gonna slow down and it's getting more narrow and more narrow until when the blood is not able to pass. Or sometimes when the blood is passing and you have that fat there, you will have pieces of the clot just move off, and then you can get a stroke, because that blood clot can move to your heart, it can move to your lung. So it is very important that what we eat, we try to eat in moderation and have small, frequent meals. Now, it is good and very, very good to exercise. Exercise is important because with the slowing of the blood flow, when you exercise, it allows the heart to pump harder, so there's an increase in the blood flow, and then more organs are now being supplied with the necessary nutrients that it needs. Now, exercise, some persons will say, okay, I walk to work every day. What you have to understand is that even though you walk every day to work, after a while, your body will look at it as, oh, this is the norm, so there's no extra work. So what we encourage is that you increase your intensity. When you increase your intensity, then the body will not look at it as, oh, this is the normal. So, and we say 30 minutes a day, probably 3 days for a week, but it doesn't have to be 30 straight minutes. When you're just starting out, don't try, and if you have other chronic illnesses, your doctor might tell you not exercise, or you cannot do vigorous exercise. But exercises can be simple. So you're at home and you're lying down You're watching television, you just lift the feet up and down, or you can just raise your hands up in the air. This is exercise. This is increasing your blood flow. And you'd be surprised when persons exercise, at least when I exercise, I feel so much better. I feel energized. I feel like I can take on the world. It is important though, if you're going to exercise, it is nice to have, it's not a must, but it is nice to have a partner. So when you're exercising, because if you are to do it on your own, you might get to say, oh my God, I don't feel like exercising today. I can't bother. You know, I'm a little too late and I have the clothes to put in the machine or I have the house to tidy up. I'm going to exercise another day. And you might put it off all the time. Now, if you have a partner and that partner is going to come and call you, you don't want every day this partner coming to call you and every day you are not available. So that will give you the push to say, okay, let me get ready because Miss Juliet is coming to exercise, is gonna come and call me in a little while to exercise and I want to make sure that I am ready. Or President Kevon is gonna come and I don't want to disappoint him today. So let me get ready, right? So that boosts you to continue the exercise because you now have company. And sometimes if you're competitive, you might want to be exercising. You want to say, okay, well, I walked longer than him or I got to the destination faster or just something like that that will boost you. And of course, if you do the exercises and you don't want, if you're, say you're at home and you're doing the exercises together, you don't want to be the first to stop sometimes. You want to say, oh, every time you finish first. So these little things will boost you to continue to do your exercises. Now, to talk about exercise, we spoke about medication. If you are on insulin, or before I go there, let me just speak about your feet. It is very, very important to check your feet and check your feet every day. If you're not able to see it and you have somebody at home that can help, you just ask them to check your feet for you. And the other thing I'm going to suggest, when you go to see your doctor, what you can do is check your blood sugar at home. So when you, and write down your values, when you go in to see the doctor, show them what your values are. And of course, if your doctor is seeing you and your doctor has not checked your feet, prior to coming out of that office or that clinic, could you just say, Doc, could you kindly check my feet? Because you want to know that everything is going well and you have not missed out on anything because you are not able to see, because of course, you know, the vision sometimes goes, but if somebody else can help you to look and identify that, yes, there is something, or I don't like how this area looks a little dark, then you'll be able to pick it up sooner than if somebody, than just you just going about your business. Now, what I will tell you is that when you go to your health center or to your doctor, if they realize that you are informed about your condition, they will spend more time with you. Now, if they think that this person doesn't really care about themselves, then they will probably just treat you as they assume that you are. No, when they will ask you to do blood tests, and most times when you have diabetes, they'll ask you to do an X-ray, they'll ask you to do an ECG because they want to see how the rest of the body is affected. Now, if some persons will drink Bush, and what happens is that sometimes these things just mask what the sugar level is. And so there's this test called the HbA1c, which will show what your sugar control is over a 3-month period. So if you've not been adhering to your diet, you've not been taking your medication, you've not been exercising, but you know you have your appointment coming up, and doctor would have given you a blood test to do, so you drink whatever you know that they say will lower the sugar, you might drink it, and then when you go in and you take the blood test, you realize, oh, this looks good. But if they should do your HbA1c, that will show that this sugar is really not under control. Now, you have to remember, it is your body, and you have to take care of your body. Nobody will take care of your body as you would. And so Your body is a temple of the Lord, and of course, you want to treat God's property right. So you want to make sure that you are taking care of your body. Now, if you go in, and sometimes what happens is that sometimes persons will, when you go into the doctor, they might say to you, are you taking your medication? And you said, yes, doctor. Doctor might not ask you, are you taking it as ordered? Because then you might say, oh, I'm on 2 pills for diabetes. I'll take this one in the morning and I'll take this one in the afternoon. I'll take this one today and tomorrow I take the other one, which was not how it was originally ordered for you. No. And I like to challenge my patients, if you're on multiple medications, I like to say, okay, stick with the medication, take it as ordered. And if when you take it as ordered for at least, let us say you went to the doctor today and they give you a 3-month appointment, take it as ordered for the 3 months. And you would be surprised because sometimes when you go into the doctor and they say, oh, you're taking your medication? Yes, I am. They don't ask you if you're taking it as ordered and you don't volunteer because you know you don't take it as ordered. So of course the sugar is high. And say, oh, but the sugar is high. I have to give you something else to help to control the sugar. And that is how sometimes persons will end up taking a lot of medications when if they had stuck to the diet and take the medication as ordered and of course put in their exercise, then they would not have been on so much. So if there's anybody in the group with diabetes and you're not taking your medication as ordered and you might be on multiple doses of medication, challenge yourself and try and take that medication as ordered and see how well your sugar will come down. Now, I've been talking quite a bit and there's something that I don't want to leave out, and that is if your sugar goes low. Now, when you're going to exercise, make sure that if you're going on the road, don't exercise in the broiling sun because that is not good for you. If you're not feeling well, do not go out and exercise, especially by yourself. If it is at all possible and you can get a little bracelet that will say you have diabetes, so in case anything happens to you, somebody will be able to see if you, let us say you fall by the wayside and somebody sees it, they'll say, okay, this bracelet is saying this person has diabetes, so let me help. No, how can you help quickly? You can just use some honey, like a tablespoon of honey, and put it in under the person's tongue, and it dissolves easily and it will bring the sugar up quickly. Walk with sweets. No. How can this nurse be telling me to walk with sweets when it's sugar that is causing the problem? If your sugar goes low, you need to bring it back up. And if you don't, you can go in a coma, meaning you will not know yourself or others. So walk with the sweets. If you feel like your sugar is going low, and some of the things that will suggest that your sugar is low, you're feeling sweaty, the skin gets cold and clammy, you're feeling fatigued, and of course, I'm sure you would be familiar with the phrase, a hungry man is an angry man. So sometimes persons just all of a sudden get very angry and you're wondering, why is this person so angry? And they were just fine just now. It could be that the sugar is out of control and that is why they are behaving like that. No. So we said you can use a honey put under the tongue. You can get a tablespoon of or 15 grams of sugar and put it under the tongue also, or in the cheek, so that is in the mouth between the gum and your cheek, and that dissolves quickly. If you have a machine, you can do the finger prick, and that will give you a quick idea. Now, of course, if say for instance, you found somebody, they have diabetes, and you've done this, and you have your machine, you check the sugar again. Now, if the sugar is still low, you repeat the same thing, the 15 grams of either glucose, sugar, honey, so a tablespoon, and you put it under the tongue or between the cheek and see how well. If after 15 minutes, so after you've done this twice and the sugar does not improve, then of course you need to go and seek medical attention immediately. say for instance, you've done it and it works and the sugar comes up, you have to get a proper meal. So once your sugar goes low, you have to, and you take something quickly. So you take the sweets or the little tablets, anything that is sweet that will bring the sugar up quickly. You can have a piece of chocolate to bring the sugar up quickly. But once you have brought up the sugar quickly, he said, easy come, easy go. So the sugar comes up quickly, it will go down back very quickly. So you need to have a proper meal to ensure that the sugar remains in good standing and you don't go hypoglycemic. And the sad thing is that hypoglycemia, which is a low blood sugar, and hyperglycemia, which is a high blood sugar, they can present almost in the same way. All right. I think I'm going to stop for now and find out if there's any question that I hope I can answer.
Okay, fellow Kiwanians, as was indicated earlier, I'm going to ask that you use up the raise hands feature. You'll be identified and you'll be allowed to ask your questions. So at this time, I'm going to open the floor to questions, and I'm going to now acknowledge Curlew Duncan.
Good evening again, everyone. My name is Curlew Duncan. Good night to you, presenter.
Good night.
Well, I'm told, I've heard that otherwise from having vegetables, the string bean is a very good thing to have when it is quickly, I would say, sauteed in warm water for about 10 seconds, and that once it brings up that bright green, then you can have it to produce the natural insulin. Is that so?
I have heard of that also. But one good thing to do, if you have a machine, you can test that theory. So if you have it, let us say you check what your sugar level is before you have that string bean, and then you check the sugar again. After that, then it will help you to see how much. And so I must interject here that with the children, they are maintained on a diet and they are given insulin. So the insulin, they will adjust the insulin to match. They'll adjust the insulin to match how much. Sorry, they'll adjust the insulin to match how much they eat, or they'll actually adjust the sugar level based on, they'll look at the sugar level and then give the insulin to help to reduce it to the level that they want it to be at.
All right, I'm seeing the hand of Dr. Harris. I hope that's Dr. Harris from the New Club Prospect. Dr. Harris, go ahead, sir.
Yes, good night, everyone.
Good evening.
Good night.
Good night. Good night, Mrs. Bennett. There's something very important that I don't know if I missed it early on, but I would like you to speak on the effect, especially for us gentlemen, as far as affecting their vim, vigor, and vitality is concerned. Because this business of diabetes can cause great frustration for the ladies, especially when such times come, and for men who may be having signs of ED and not recognizing that this could be one of the causative things for that. So you can explain that one. Thank you.
All right, thank you. I did not go in detail about it, but of course, very important, very, very important, gentlemen. It can cause, you would have heard him say ED, which is erectile dysfunction. And of course, it can affect a person's sex drive. So you probably might not have that urge to have sex. And if your partner wants it and you won't, they will think that, oh, this person must be cheating. Why no? I'm not getting anything when I used to get it every night. Also, it will make you feel incompetent if you are there and you're not able to function. It lowers your self-esteem. So it is important that, of course, you keep your sugar low, because of course you don't want to be you don't want to be second all the time, or you don't want to be first all the time either, right? So you have to make sure that you keep your body up to shape or in shape, so that whenever you are expected to rise to the challenge, you are able to rise.
I can't wait for the opportunity as soon as that club is chartered to levy a charge against prospect Dr. Kirk. Yes, at this time I'm going to acknowledge Director Judith.
Good evening, Nurse Charnette.
Good evening.
Okay, I don't know if I've missed this section, but I keep hearing you saying, check the feed, check the feed, check the feed for what?
All right, so if there are any cuts or bruises, if there's any discoloration of the feet, because if there's no, all right, you might have seen persons with like the feet look a little darker than the rest of the body, and that is a sign of poor circulation. Now, I've said persons with diabetes, sometimes if they get a cut, they might not know because the nerve is damaged, and so they won't feel it. Like you get a cut and you feel it burn, you might not feel it because the nerve is damaged. So it is important that you check to see, make sure you have no cuts or bruises, because then you can quickly lose a limb because of this.
Okay, thank you.
You're welcome. I see a hand raised. I'm not sure whose hand it is.
Apologies. Yes, getting back there. DLG Christine Long, I'm going to ask you to go ahead.
Thank you, President Kevon. Good evening, Nurse Charnette. And thank you for that great presentation. I am a diabetic, perhaps about 30 years or so. And, you know, and so can identify with much of what you have said. It runs in the family, and I've lost quite a few family members from this malaise, including my mother and some younger cousins.
Wow,
and I recall when my mother used to always drink cashew bark whenever she was supposed to go to the doctor. So she would disguise it, you know, and then she'd come back quite happy that her blood sugar or urine didn't show anything and so on. And then it affected her so badly when she started to lose weight, she couldn't stop, no matter, you know, because it had damaged the organs. I noticed that I heard you speak about the tingling in, you know, the feet and the hands, and I'm suspecting that I have diabetic neuropathy. You know, because for example, the other night I felt a terrible burning and tingling in the soles of my feet, and I said, oh my God, my blood sugar must be very high. But when I checked it, it was only 4.1. It was actually low. And so I got something to eat, and it improved, you know, it stopped. And then another evening I felt it again, and I said, but what is happening? I checked my blood sugar, it was 5.8, which was normal to my mind. Yet I'm still having this burning sensation in the soles of my feet, even right now as I speak.
All right, so
you can speak to that.
So what is happening? Remember now that the nerve damage, it does not necessarily mean that when you're having the sensation is when the sugar is low. It is a long-term effect of the sugar. So you will get that sensation, but even if you check the sugar right away, it might not reflect a high or a low at that time. It's just that the damage has started to take place.
Okay. Yep. Any remedy for that?
So what you can do though, is so when you feel them, you can do your little exercises. So like when I get a numbness or tingling in my hands, I tend to move them like this to help it to feel that easier circulation, and it actually helps.
Yes.
And because it is now improving the circulation in the area, and of course, I tend to just wiggle my feet in almost like manner.
Okay.
To feel, and it helps me to feel better. But of course, you know, it's a long-term thing. What you can do is have when you go back to see your doctor, you can have them check if your nerves are, what the status of your nerves are as it relates to feet and hands.
Okay, thank you so much. Thank you.
You're welcome.
All right, so now I'm going to acknowledge Courtney from the Kiwanis Club of Montego Bay.
Yes, good night.
Night.
Yes, nurse. Enjoy your speech. This is Dr. Williams, Courtney Williams. And since you didn't mention my part of the medical, where should I say, requirement for diabetic, which is the eyes, because I'm seeing a lot of patients with severe retinopathy and early cataracts, and although they have diabetes, I'm not sure that their doctors are telling them to get their eyes checked yearly, which to me is a requirement to prevent blindness in the future. So do you have anything to tell the members about the effect of diabetes on the eye?
Okay, I'd mention it, but I should say probably I mentioned it in passing, but of course it is very important that you get your eyes checked. I'd mentioned when you talk about the blurred vision and some persons that are affected with the driving at night. But of course, it must be one of the requirements when you go to see your physician. If they don't ask you when was the last time you had your eyes checked, you must suggest to them that, doc, can you, if you have not yet seen your ophthalmologist, ask them if you can make me a referral to see the eye doctor so that they can check to see and make sure, because you really don't want to lose your vision. I always say, diabetes is a condition in which you can either die or you can beat it. And the empowerment from us is to say, you are going to beat this. You don't have to die. I always say to my patients, you want to be able to move around. You want to be able to see. You don't want to be dependent on anybody to have to come and give you everything that you need, because there's gonna come a time when you're gonna want something and you're calling and nobody is there to answer. And you're gonna get frustrated. And of course, I didn't mention, in fact, but diabetes also causes depression. Because when persons look at the state, sometimes if they're far gone and there's not much they can do and they feel limited, and even sometimes just simple taking them of medication may cause you to feel depressed. So it is important that control. We cannot overemphasize control, because it's gonna, as I said, it affects every organ of the body. And what it will do, it will slowly, so you might have loss of vision, the kidneys go, you lose a limb, you get a stroke, you may even get a heart attack. It just affects every organ of the body. So once you keep that sugar under control, you'll be able to manage. And of course, you must maintain your doctor's appointment. Go in and get your checks done so that you can know what direction you're going and in what way you can make improvement in your life or in your management.
All right, thank you. At this point in time, I'm going to recognize Kiwan and Patrick to go ahead with your question.
Yes, good night, everyone. Nurse, that was a very, very excellent presentation.
Thank you.
I can identify with all of what you have been saying, and like Ms. Long, my diabetes seemed to be hereditary because I have been diabetic for over 21 years now. What I noticed, you talk about control, and I think I do a very good job of controlling because, well, you know, I'm a foodie, but in terms of the exercise and the medication, I really stick to that, and I'm an exercise freak. Now, what I would like to know, I noticed that quite a number of websites or so on talk about the cure, and you talk about control. Is it curable? And I know that it's a debilitating illness. And so although you may have the control over the years, could it be that after a while, because you have it so long, all these adverse effects come on you, although you were controlling them?
All right, so I personally don't believe it can be cured. What I say, it can be controlled. No, if you maintain a good control, then usually it takes a longer time to have the debilitating effect on you. No, you say you're a foodie, you exercise. So of course, sometimes what you might want to do is to see, okay, since food is my weakness, let me cut back and see how this food thing will go as it relates. But if you're getting good control, so remember one of the things that we say, you know, is that the body might not be producing enough insulin. And as to the example of walking in your shoe every day, for a while, if your body is not able to, the body gets tired, and then the pancreas has worked and worked and worked and worked and worked. After a while, it will just not produce. So you will have some persons who might have been taking their medication as ordered, they've been having their diet, maintaining a proper diet. Sorry, but after a while, they still would have to move from taking tablets and move on to taking insulin. And it does not mean that you are bad or you've done anything wrong. It's just a part of the disease process.
Well, thank God, since I'm older now, I sort of eating less and less. I find that I can't eat as much as I used to. So that is one good thing.
One other thing I did not mention, and it is very important, for persons who are on insulin, you must take the insulin. If you're on, let us say, if you're on soluble insulin, just 1 minute, my battery is going low. I just need to plug in my device, sorry. All right, sorry about that. All right, so if you're on insulin, you should take that insulin half an hour before
We're not hearing you, nurse.
We are not hearing nurse at all.
Not hearing you. Not hearing you.
Yes. Because in the demand by food.
All right, please bear with us just a moment, Kiwanians and guests, while we try to sort this technical difficulty out. Nurse, are you back with us? Still unable to hear you. All right, do you want to try exiting with the device and re-entering with that device? Right, so while we're trying to reestablish contact with audio from Nurse Etlock Barnett, I want to thank you guys for being such a wonderful audience so far. You guys are doing a wonderful job. Are there any Kiwanis clubs that came in after the official welcome was done? I'm going to ask you to just unmute your microphone. I've allowed you to unmute and just introduce your delegation. Any clubs that came in after the official welcome?
Hi, President Kevin.
Hi.
Good afternoon, fellow Kiwanians and guests. President Nardia here from the Kiwanis Club of Greater Portmore. With me, I'm seeing where DP Blanzo was on, Director Sonia, DP Jennifer, and myself. This is a very informative meeting. Thank you.
Always a pleasure to have you online with the Kiwanis Club of Greater Portmore. Nurse, are you back?
Are you able to hear me now?
Yes, we are able to hear you.
Yes, we're hearing you.
Okay,
Yes,
thank you.
we're
Sorry
hearing
about
you.
that. I'm not so good at technology.
Neither am
All
I.
right. So I was saying for the insulin, when you're taking the insulin, you ought to take it half an hour before your meal, because what happens is that the insulin starts working in a half an hour, it peaks in 2 hours. So when it peaks is at the same time when the food that you eat would have been broken down. So both the food and the insulin would be working together, and so that you would get a high or a low. Sometimes, and even in hospitals, some persons make the mistake of taking the insulin after they have had their meal. Now, what happens is that if that is done, there is nothing for the insulin to work on because the meal would have been broken down already. And so persons will get what we call a hypoglycemia. So the insulin is going to work whether you eat or not. And so it is very important that if you're not sure of what you're going to eat, and if you're in hospital and they offer you a meal, you're not sure if you want that meal, don't take the insulin until you know that you have that meal ready. If you're in hospital, because sometimes I'll tell you, as nurses, not everybody is very educated about it. And so they might come and say, okay, I've seen where doctor wrote you to have your insulin at 10 o'clock. And so they will give you your insulin. You have to say, no, my insulin, I'm to take it half an hour before my meal so that it can work. And once you're educated and you tell them that, they will, of course, once they're sensible, they'll go and check it out. But don't ever take your insulin and don't eat, because the insulin is going to work.
Okay, thank you very much. Fellow Kiwanians, diplomats, we are upon we have surpassed the time allotted for our meeting. So at this point in time, I'm going to ask someone to move a motion for an extension of, let's say, 15 minutes to conclude this meeting. May I have a motion, please?
I so move.
Thank you very much. Do I have a seconder?
Yes. I will second the motion.
Thank you very much. Go ahead.
You're welcome.
Right. So we'll take 1 or 2 more questions, 2 being the most. And I'm going to, at this time, allow DP Stewart to go ahead with his question.
Oh, thank you, President Kevin.
DP Stewart?
Yes, thank you. I just unmuted myself. Nurse, very, very informative presentation. What I like about it is that you pull together the different parts to make us understand why, you have heard what you should do, but you made it clear as to why and what was the reason why, what is affecting what. What I want to ask you though is there is this thing they've called the glycemic index, which is, I think, well, you would know what that is, but as just as part of the question, it's supposed to measure those foods. It's a measure of those foods that act quickly in terms of converting to carbohydrates. And the people, for example, sweet potato, I mean, not sweet potato, Irish potato and stuff like that is high on the glycemic index. And they recommend that you eat more like sweet potato. But what I want to ask you, how important is it not to get that spike? Because that's what they're trying to avoid. How critical is it if it is gonna come down after you take your tablets or whatever?
All right, so what I usually, and especially for persons with type 1 diabetes, I usually tell them to eat. When you eat, you see how it sends the sugar up, and so you check the glucose level after you've eaten to see how it really affects you. Now, you spoke about the Irish potato as opposed to the sweet potato, and people also say white bread and brown bread. Now, for the most part, white bread and brown bread have the same amount of calories. However, the white bread breaks down faster than the brown bread. So persons tend to move towards brown bread. Mangoes are very sweet. So even though people tell you must have your fruits, mangoes can be sweet and some of the fruits can be very sweet. So what we usually do in our teaching, we have what we call a food exchange list. And I am sorry, I don't have a copy of that with me right now that I could share some of the things, but it actually gives you a guide as to how you can take some things and you mix and match your diet so that it doesn't become monotonous and boring, and you don't feel like, oh my God, every day I have to eat bread. It shows you can eat a little piece of yam, you can eat bananas, you can have fruits for breakfast if you so choose. But what you have to do is to have a good and a tight control. When you eat, because some persons, it will send up their sugar faster than others, even if they eat the same thing. So what you can do is when you eat, you check that sugar level and see how one thing sends up your sugar as opposed to the other that might not send it up as so quickly.
Thank you.
You're welcome.
I've seen a question in the chat, Nurse. It says, just want a little more elaboration on where on the feet to look for signs and the color and feel of the location stated.
All right, so it is all over your feet. But in terms of the discoloration, usually it happens from your toes, come up to your ankles, and it can extend depending on how badly it is. Now, some persons, if you have that discoloration, I'm gonna say, because I don't want to tell you to use a pin to prick it to see, because then that is gonna cause a break in the integrity of the skin. So what I would suggest is you can use ice and see if you're feeling it. So if your legs look discolored or your feet look discolored, you can just use a bit of ice and say, okay, am I still feeling this sensation? Or is it much less than if I put it a little higher?
All right, thank you very much, Nurse.
You're
we're
welcome.
going to be moving swiftly through the program. And at this point in time, I know I said thank you, Nurse, but guess what? There's somebody else who is going to do a better thank you than I am doing right now. And at this point in time, I'm going to call on none other than DP Stacy to do the official welcome. The official thank you.
Thank you, President Kevon. Nurse Heslop Barrett, you opened our eyes so much this evening in regards to your presentation. So on behalf of President Kevon and the Kiwanis clubs internationally, sharing with us this evening. We are very delighted that you took the time to break this chronic disease, diabetes, down for us and show us how it impacts our lives in so many ways. We know this is just the tip of the iceberg, but we know that you broke it down for us and you made us conscious as to what it is, how to prevent, and how to control it. So again, this evening, we present to you this certificate of appreciation to you from our Kiwanis Club of Linstead for this wonderful presentation that you delivered this evening. Thank you, Nurse Heslop Barnett.
Thank you very much for having me. It was my pleasure. And of course, I love education. If you know of persons that have diabetes, I am willing to sit and talk with you to guide you through the process and to see how best I can help or in what way I can help. Thank you so much.
All right, thank you very much, DP Stacy, and once again, thank you, Nurse Barnett, for that wonderful presentation to us. Fellow Kiwanans and guests, it has been quite a long evening, and we are going to be drawing swiftly to a close. At this point in time, are there any clubs who have any announcements? Any clubs with announcements?
President Kevin?
Yes.
Yes. The Kiwanis Club of Greater Portmore on December 18th will be having our pre-Christmas dinner. It's like a pre-Christmas dinner, but it's more of a drive-through. You would come and pick up your dinner, and that's it. We're not gonna be sitting and having anything. You just have to come and pick up. So you drive, you pick up, and then you leave. And that is for December 18th. That is for December 18th. More information will be forwarded later.
What's the cost?
What's the cost?
It's $2,000. You'll be getting your drinks as usual, your cake, your dinner, chicken, fish, pork.
Any ham in it? Any ham
Yes,
in it?
yes, sir. Yes, IPP.
Oh,
There's
okay.
one.
All right.
Yes, we will.
All right, thank you very much,
So it
President.
will be as the norm, but it's just that this time we're not going to be sitting together and eating.
Okay,
All
thank you
right.
very much, President Nordia.
Thank you, sir.
Any other club with that?
President, it will be pre-packaged, or is when we get there you serve it?
No, it will be pre-packaged, but if persons come and did not make their order before, then we can also package it there, because we're gonna do it at DP Blanzo's home. So we have the space there for everything.
Okay. Okay.
All
Thank
right.
you very much. Any other club with an announcement? All right, if there are no other announcements, I'm just going to do a
President Kevon,
Go ahead.
may I ask Nurse Sharonette a quick question if she's still on? I just want Nurse, I just want to know how long after you have eaten should you check the blood sugar to see the increased level? How long after you have eaten? Half an hour, 1 hour?
2 hours.
2 hours. Okay, thanks.
Thank you. Any other announcements?
Yes, President Kevon, President Lillian from Kiwanis Club, First City. Just want to invite you all to our fundraiser.
Delete. There was like.
To our,
Go ahead.
yes, our Kiwanis Club, the First City, we are presenting our cake sale fundraiser on December 11. You can call me at 796-5934 and I will provide you with more information. We need your support, guys. We have a lot of projects and we need money to do it. Thank you.
Thank you very much, President Lillian.
Hi, President Kevon. This is DP Megan from the Kiwanis Club of Montego Bay. We're inviting you all to our K Family Night. That's tomorrow, Thursday, November 26th. It starts at 6 p.m. The Zoom link can be shared with you. And our guest speaker will be Brooke Ann Bowen, who is the Bank of Jamaica Scholarship Awardee. So that's tomorrow night, our K Family Night meeting, and it's 6 p.m. and it's the Kiwanis Club of Montego Bay.
Please ensure that you shoot us the link.
I will.
Thank you. Any other announcements? All right, if there are no other announcements, we are going to move swiftly down the program. Because of the time constraint, I'm going to ask that all members of the Kiwanis Club of Linstead please send your blanket charge of no more or no less. Well, if you want to send more, send it. Not going to stop you. But of no less than 100 Jamaican dollars. So please ensure that our Sarge gets the money. All right. Fellow Kiwanis and guests, it has been a wonderful evening. We have heard from our guest speaker who has presented to us, and we have just enjoyed each other's company. At this point in time, I'm going to ask that we raise our imaginary glasses as we propose a toast to Kiwanis International
Friendly Jamaica.
And we say, safe journey from
home.
Safe journey from your bed, from the living room to the
It's too late for the fridge now.
Hi, Madam Gertley.
Hey, put on weight at this time. Hi, June. How are you doing?
I'm great. I'm great.
Good night, everybody.
So I have not terminated the meeting as yet, fellow Kiwanians.
Have a good evening.
The meeting is now terminated.
Good night, everyone, and stay safe.
Good night, everyone. Rest well.
Good night, everyone. Rest well.
And be safe.
Good night, everyone.
Good night.
Hi, President.
Good night. Good night.
Good night. It was very good.
Yes.
Good night, everyone.
Yes.
Informative meeting. Thank you.
Good meeting as usual, President.
Hello.
How you do?
I'm not too bad at all, you know.
Yeah, man. Praises.
Trying to beat COVID and doing as best as we can at school.
Yes, darling. Keep safe.
Thank you, DP June.
Good night, all.
Good
night, DG Melford.
Good to have you again.
DG Mel soon move come to Jamaica, you hear?
Ex officio citizen.
Yes.
Be nice, be nice.
Yes, man. DG Mel soon come back to Jamaica.
Stay safe.
For all of the white rubbers.
Thank you.
Yes, man. You know.
DLG Christine Long.
Yes.
How are you?
How are you doing?
I'm great. And you?